have spoken about this doctor before. He goes by the name of Dr. Six. Dr. Martin Eugenberg is a Toronto plastic surgeon. He's got a big following on Instagram, and he posts a lot of before and after pictures of procedures that he does. Well, it went before, and it was the first day of a disciplinary hearing of the College and Physicians and Surgeons today on charges of engaging in disgraceful, dishonorable, or unprofessional conduct. Really, he's accused of posting pre- and post-op images of patients on his social media accounts without their consent, making inappropriate comments, touching patients in an inappropriate manner. So joining us to talk about this is a regular on our show and a great friend of the Nightside. Dr. Stephen Mulholland is the founder of Spa Medica, and he's one of Canada's top cosmetic plastic surgeons. Dr. Mulholland, welcome back to our pandemic show.
Barb, thanks for having me.
This is a really interesting story because when I read this, I think about, I'm sure you're aware of Dr. Miami, who is also big on social media, and this sort of fine line that professionals walk these days with, feeling like they have to have some kind of social media presence, yet they have to maintain the integrity of their practice.
You're exactly right, and it is a bit disturbing. And I'm a big fan of patients getting access to information and doing their research. And social media has been great in that regard. It has some dangers, but it's been great because they have access to live procedures. YouTube gives them access unprecedented to any operation, both how it's done and the before and afters. And and the good, the bad, and the unfortunate, because patients need to consider the risks, the benefits, the recovery, and the costs. However, we are bound as physicians by several, first and foremost, the Hippocratic Oath. We're bound by an obligation as a physician to ensure we do good and we ensure their safety and we protect their personal and private healthcare information. And then we're enshrined by a federal law called PIPEDA, which is the Personal Information Protection and then Electronic Data Act. So PIPEDA is, it outlines for private corporations what you can do with information, including healthcare information, what you can't do with it. And the overriding impetus for a physician is to obtain consent. Some patients don't mind their before and afters. They're proud of them and they want to talk about them and they want to show them off. And that's great, but you need their explicit consent to do so. And many patients would be horrified to find out their before and afters would be broadcast or used on the internet or on a website. And so personal protection of healthcare information is sacrosanct and part of the patient-physician relationship. And so, the alleged transgression was that some before and afters were published on social media sites, Instagram in this case, without consent. The Dr. Miami is interesting because he really led the revolution in live streaming procedures, which is okay if the patient consents to that. And this particular physician is well trained. He's a Memorial Sloan Kettering breast cancer reconstruction surgeon, very well trained. And he went down and trained with Dr. Miami, and that's okay too, to have that franchise here in Toronto and live streamed helps patients understand procedures better, those that want to see it. Some patients don't want to know anything. They don't want to see live procedures. They find it horrifying. They just don't want to know about it. But again, I'm a big fan of education if that's what patients need. Great, but you must get their consent. And the other issue then was that within the clinic there were cameras in every room and photos and videos being taken of patients disrobing, and this was saved to a hard drive, and there was no explicit consent that this would be taped. Now, some physicians, particularly in the U.S., they tape everything in case there's, the patient claims that something was done when it wasn't done. There's some video records, so I get that, but you still need to get the patient's consent. Most surgeons, like me, for 25 years, will just bring a nurse into the room with them so there's no dispute and anything inappropriate could have been done. You don't want to leave yourself exposed, and you want the patient to feel very confident that nothing untoward is going to happen. This extends now to online, where we have to get a virtual care consent before we can exchange data, and we have to use a secure site like GoToMeeting, which is federally approved as sharing healthcare information, or DoxyMe. So it's become a very, very important part of understanding the sharing of personal information and not transgressing the patient's right to their privacy.
Michelle Mandel has been covering the story for the Toronto Sun, and she actually posted an update. I just looked at when we were in the break on day one of the hearing, and there was a story that she relays of a patient who was asked minutes before her breast augmentation surgery if a global TV could be in the operating room, and she said she told him no, and then later found a link to a story that she feels he had allowed them into the operating room. It's kind of hard to believe that sort of thing could happen.
It's disturbing and unfortunate because, as I say, it's a very well-trained surgeon. And again, this will come out in the proceedings of the College of Physicians and Surgeons, and the facts will come out. But in general terms, you can't get true consent minutes before a procedure. Often there's pre-medication. Patient doesn't have time to consider the risks and the benefits of having their story broadcast. And so even the consent that would be under duress or perceived as being under duress, it was obtained just minutes prior to the procedure, when the patient clearly isn't in a position to consider the implications of having something broadcast live, and they may have had medications which mitigated their ability to make that decision.
It's actually a great point. Could someone lose their license over charges like these if he is found to have committed these things?
There's many things that would be extremely harsh punishment, and one of which, of course, is inappropriate touching and inappropriate contact, and some people are just touchy-feely. You need to be very cautious as a physician. If you're a Joe Biden kind of guy, you need to pull that back and be very, very cautious and conscious, especially in plastic surgery. We're dealing with, with external parts and breasts and inner thighs, abdomens. You've got to just be very professional always, and always have a nurse there with you to document your behavior. And so, it can be suspension of license or loss of license, re-education. If found guilty on any one of those charges, certainly re-education on what is privacy laws and what you need to do to protect that patient. But certainly inappropriate touching would be license suspension, even license loss.
Dr. Stephen Mulholland, we always enjoy having you on. Thank you so much for this.
Oh, thanks again. I guess it's important patients, again, know their rights and ensure that the physician they select is protecting their rights as well as their safety and outcome.
It's a great point. We look forward to having you on again. Thank you.
Thanks again, Barb. Take care.
Dr. Stephen Mulholland is the founder of Spa Medica, and he is one of Canada's top cosmetic plastic surgeons.